Rhythmic muscular contractions.
Sudden release of sexual tension.
Intensely pleasurable sensations.
Rapid relaxation.
Let's talk about orgasm.
Orgasm. What is an orgasm? An orgasm is defined as the sudden discharge of accumulated sexual tension resulting in the rhythmic muscular contractions in the pelvic region that produce intensely pleasurable sensations followed by rapid relaxation. After hearing that definition, an orgasm seems like something everyone would want to achieve. In order to do this, it is important to know the different sexual response stages one goes through. And now, to talk about the stages.
According to Master and Johnson, our bodies go through 4 different stages of sexual response. The stages include excitement, plateau, orgasm, and resolution. This is known as the EPOR model. The male sexual response cycle is seen as predictable when thinking of these 4 stages. They also require time between orgasms known as a refractory period. Females, on the other hand, may go through all 4 stages with ease, do not normally experience a refractory period, and may experience only 3 of the 4 stages without orgasm.
For men, signs of sexual arousal include erection of the penis and scrotal skin tightness due to the testicles enlarging and raising up toward the underside of the penis.
Women undergo physical changes such as erection of the clitoris, vaginal lubrication, and the swelling of the labia minora, causing the separation from the opening of the vagina. Internal changes occur as well, such as the engorgement of the uterus and a slight movement to the abdominal cavity. The vagina changes shape and opens longer and wider. Breasts, nipples, and areola enlarge slightly as well.
Orgasm. With enough sexual stimulation, men and women can achieve orgasm. This can come from many sexual acts such as intercourse, masturbation, anal sex, oral sex, and other preferences. According to Masters and Johnson, an orgasm lasts about 15 seconds and can vary in intensity from person to person. Although penetration of the penis is pleasurable to heterosexual females, this stimulation alone may not always cause women to reach orgasm. Most females need some form of stimulation to the clitoral area before, after, or during intercourse. On the other hand, there are some women who can find direct stimulation of the clitoris highly sensitive and can cause discomfort. Women, unlike men, have the ability to have multiple orgasms without a refractory period. As the orgasm approaches, men and women continue to increasingly breathe rapidly and their blood pressure continues to rise. Usually there is a loss of control of voluntary muscles, which causes muscle contractions and spasms, usually of the hands and feet. There are many health benefits to orgasm. It has been found to help with general health and pain relief. It is also true that reduces rates of cancer, acts as a mood enhancer, helps you live longer, and helps with better sleep. With orgasm, men usually experience ejaculation. Okay, that's it.
It is important to know that orgasm is different from ejaculation. It is not uncommon for a man to experience orgasm without ejaculation, but for the most part, they occur together. Ejaculation occurs in 2 stages. The first is emission. This is when the semen builds up in the urethral bowl. This indicates that ejaculation has begun and nothing can stop it. The second stage is expulsion, where the semen is pushed through the urethra and out of the penis. Most people do not think of women being able to ejaculate, but there have also been few studies of this topic. There is a debate that ejaculation that occurs with women is identical to urine, but others believe that it is a fluid similar to semen. Some research finds that the fluid produced by females come from the Skene's glands. These glands are on both sides of the urethra. These glands were once thought to have no function prior to these findings. There is some speculation that the fluids secreted from these glands are intended to help prevent the growth of bacteria, which causes urinary tract infection. Thinking from an evolution standpoint, if women have less UTIs, they would be able to engage in sexual intercourse more frequently, and this would enhance the chances of pregnancy. About 40 to 50% of women report ejaculation, but there is nothing wrong with a woman if they do not experience it. In fact, women who report ejaculation have said that there is no greater sexual satisfaction to it.
After orgasm, the body returns to its normal physiological state. This is the resolution phase in Masters and Johnson's EPOR model. This process usually happens quickly, but can take time if an orgasm has not occurred. For both men and women, heart rate, blood pressure, and muscle tension drop. Both feel relaxed, content, and sleepy.
In women, their blood flows from the breast and genitals. The breast, nipples, and areolas are no longer enlarged, and clitoris is no longer erect and shrinks slightly. The labia minora are no longer swelling, and the cervix widens to let sperm in. Half an hour after orgasm, the uterus returns to its original state.
For men, their nipples are no longer erect, as well as the penis, and the penile glands lighten in color. The scrotal skin relaxes, and the testicles drop.
Masters and Johnson's EPOR model has been used as the main explanation for human sexual response, but some have questioned their findings. One major criticism is the lack of emotional or psychological characteristics related to sexuality, such as desire. The model showcases purely physical reactions to sexual stimulus, but neglects the psychological aspects. There have also been some worries that the model can cause sexual partners to see the 4 stages as something to strive for, but the sexual process is far more complex than a series of steps and goals. Many of the psychological factors not discussed by Masters and Johnson make sexual intercourse much more pleasurable.
Did you enjoy yourself?